Today we're going to be discussing a recent scientific advisory that we prepared for the American Heart Association. The scientific advisory presents in a very concise manner but very detailed all the considerations that were taken in these important 6 clinical trials that attempted to expand the use of endovascular techniques for those patients that have large core ischemic stroke. When we analyzed the 6 clinical trials that were recently completed for the treatment of patients with large core ischemic stroke, we found that the majority of them included patients that have ASPEX 3 to 5. That means was larger than in the previous pivotal trials, however, still within a volume that some people would consider not extremely large. There was only one clinical trial that consistently and systematically include patients with very large acute ischemic stroke cores, that is ASPEX 0 to 2. In that clinical trial, there were some restrictions of time. Most of the patients were included within 6.5 hours from the last known weld, and this was restricted also for patients which ages were younger than 80. All the clinical trials have very good design. From the methodological perspective, they were randomized with blinded endpoint assignments and have generally low levels of deviations, which gives a lot of confidence in the levels of evidence that they provided. Several aspects were analyzed in these clinical trials, including fundamentally as primary endpoint the ability of the patients to be functionally independent. Other outcomes that were evaluated included the independence to be able to walk and other concerns that arise when you are considering treating patients with large core stroke, things like symptomatic hemorrhage, mortality, or rates of decompressive hemicraniectomies.